Why does oligodendroglioma grade matter for brain tumor treatment? Imagine trying to fix a small crack in a wall versus repairing a large, deep hole. The approach and urgency are different, right? The same idea applies when doctors look at oligodendrogliomas in the brain. The grade of the tumor tells us how quickly it is growing and how aggressive it might be. This information is key in planning the best treatment for each patient. Oligodendrogliomas are tumors that develop from oligodendrocytes, which are cells in the brain that help insulate nerve fibers. These tumors can be classified into two main grades. The first is grade 2, which is considered low grade. These tumors tend to grow slowly and are less likely to spread quickly. The second is grade 3, also called anaplastic oligodendroglioma, which grows faster and is more aggressive. Because of these differences, the treatment approach varies significantly. When it comes to surgery, both types usually involve removing as much of the tumor as safely possible. For low-grade tumors, surgery might be enough if the tumor is small and not causing symptoms. Sometimes, doctors choose to monitor the patient closely after surgery, especially if the tumor is not growing fast. For higher-grade tumors, surgery is often followed by additional treatments right away because these tumors tend to come back or worsen more quickly. Radiation therapy and chemotherapy are common treatments after surgery. For low-grade tumors, doctors might wait and see if the tumor shows signs of growing before starting radiation or chemotherapy. When they do decide to treat, they often combine radiation with chemotherapy to help control the tumor. For more aggressive grade 3 tumors, doctors usually recommend radiation therapy followed by chemotherapy soon after surgery. The goal is to slow down the tumor's growth and improve the chances of longer survival. Another important factor is the molecular makeup of the tumor. Many oligodendrogliomas have specific genetic features, like mutations in the IDH gene and deletions in parts of chromosomes called 1p and 19q. These markers help doctors predict how well the tumor might respond to treatment. Tumors with these features tend to respond better and have a more favorable outlook, regardless of the grade. Monitoring is essential for both tumor types. Since low-grade tumors grow slowly, patients might have longer periods without symptoms and less aggressive treatment. However, regular MRI scans are necessary to catch any signs of progression early. For higher-grade tumors, closer follow-up is needed because they can recur or worsen more quickly, requiring prompt adjustments to treatment plans. In summary, understanding the grade of an oligodendroglioma helps doctors decide how aggressive the treatment should be and when to start it. Low-grade tumors may be managed with surgery and careful observation, while higher-grade tumors often need immediate, combined therapy to give the patient the best chance for longer, healthier life. Always remember, each case is unique, so personalized treatment plans developed with healthcare professionals are essential for optimal care. If you or a loved one are facing this diagnosis, consult with a specialized medical team to explore the best options tailored to your situation.